topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Houston. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. Hey, before we get started with the show, we've got such a great guest on. I cannot believe this show, which we are now doing at the entire 50 minutes, we're doing it twice a month. We are getting so many texts from people wanting to know how come the show doesn't run more often. In fact, I talked to James about that. We have never had that with that when it's because we have a lot of shows that are the full 50 minutes twice a month, but I've never had this happen with a 50-minute show. So I appreciate it. We might be able to do something, but for sure, James is with us every month. We talk about sleep apnea. Today, we're going to show actually how nasal congestion coincides with sleep apnea. And I got to tell you, hey, good afternoon, James.
Hello, how are you? Good afternoon.
I got to tell you, I not only I do, but so does the audience, and really appreciates the work you're putting into the show with the slides that you provide. It makes such a big difference, and it makes your show so much more interesting.
I'm glad that's the case. That's the goal.
Tell people, because we're getting new listeners each week, tell people about Sugarland ENT and Sleep Center.
We're a practice located in near University in 59. Been here about 3 or 4 years. Before that, I was in West Houston for about 15 years, and I'm kind of uniquely trained. I'm triple board certified in head and neck surgery, ear, nose, and throat, and then sleep. And it's triple because there's 2 different boards that certify sleep. Now they changed it, so I had to get another one. But anyway, and I've treated sleep apnea for over 20 years. We pretty much offer every reasonable treatment option for obstructive sleep apnea outside of maxillomandibular advancement surgery, which is a big operation that oral surgeons do. But we offer and manage air pressure therapy, oral appliance therapy, all the soft tissue surgeries, neuromodulation, etc. So we have a very comprehensive approach to treating sleep apnea. We make sure patients are very educated on all the different choices and options so that they don't feel like they just have one choice. And I personally treat at least 1,000 new sleep patients a year. And I'm not even including all the sinus and allergy visits that we take care of. And today I wanted to talk about nasal congestion because it's, I think, a very poorly understood topic. I mean, I know a lot of people suffer from it, but probably don't really understand why. And it can be intimately related to sleep apnea or poor sleep quality, because if you don't breathe well through your nose and you're congested, independent of having sleep apnea, you won't sleep well. That's why there's a whole big long row at the drugstore of cold and sinus medications, because people don't like feeling like that. And they often pick the wrong medication or the incorrect medications because they don't understand the difference between all the different choices. And a lot of these choices are multi-drug formulas. They're honestly just repackaged and rebranded generic medications that are mixed in different ways. So So if you have congestion, you don't sleep well. If you do have sleep apnea and you're trying to use a CPAP machine and your nose is all congested, it's not going to make it easy for you to use that device. If you are trying to wear an oral appliance and you have this extra material in your mouth and you can't breathe through your nose, it's not going to help you wear your oral appliance. And honestly, there are some people who just have mild sleep apnea that if you just fix their nasal congestion, you can cure them of sleep apnea. So there are a lot of reasons to talk about nasal congestion. I thought it was very important to bring that up. So I prepared a basic presentation for everyone today.
I wanted to get this in before you get started. We started promoting your show 2 days out, and I guess somebody in San Antonio saw that you're going to be talking about nasal congestion, and they want to know, why is their nose constantly running?
Yeah, well, that can be inflammation, or you could be like people that sweat too much. It could be neurologic. You just have overactive glands or overactive stimulation. That's part of the evaluations to figure out is it an inflammatory component or is it a neurologic? Like, for example, if you live in a cold climate, like I'm from Michigan, and you go outside in the winter, your nose runs. I mean, you go skiing, everyone's nose is running, and that's normal. That's not allergy. You're not allergic to snow. You're not allergic to 10 degrees. You might think you are, but it's just a neurologic phenomenon. And the same thing can happen even without, you eat spicy food and you get a runny nose. Same thing, right? So those aren't allergies. Those are just neurologic reactions. And sometimes people just have overactive, stimulation by the nerve of the glands. And so we can treat that. So that's usually called postnasal drip, and the condition is called chronic rhinitis. If you take things like Zyrtec or Allegra and you're using topical steroids to block inflammation and you don't get much relief from that, then there's a good chance that you just have chronic rhinitis, or you could have an undiagnosed sinus problem that can give you drainage. So that's the trick, right? To find out why. And once you know why, then you can get the treatment that you need to resolve it.
One other thing before we get started, because I've told people I suffer, or I don't now because I have a CPAP machine.
Yeah.
But I got to tell you, just from you've done several shows now, knowing what I know about sleep apnea, I got to tell you, you would be the doctor I would go to. And I'm going to tell you why. You don't just recommend, if you go to a dentist, they're going to give you, an appliance. Or if you go to a sleep clinic, they might give you a CPAP. You've got so many different ways to treat somebody. And I got to tell you, if you think you're suffering from sleep apnea, and you're going to learn a lot about it from this show, I got to tell you, Dr. Ludwig, you would be my first choice anytime.
Thank you.
So I had to throw that in.
I appreciate that. Yeah, I'm very big believer in patient education. That's why we don't schedule 30 or 40 people a day. I typically spend 45 minutes at least with a new sleep patient, because we have animation software that we use to help. Actually, some of the pictures you're going to see today are from screenshots of that software. I think understanding is a big part of the treatment, because if you don't understand the problem and you're not motivated to treat it, then you're not going to treat it. And I see lots of people every day who have been previously diagnosed with sleep apnea who don't treat it because they don't understand it, or don't think they need to, or think the treatment's worse than the disease, so they just do nothing. And it's important to do something. I think once you understand what's going on, you should do something.
Embarrassed. You know, when you tell somebody, hey, you were snoring, they always deny it, even though they were snoring.
Yeah. But you know what's funny too, though, because my patients tell me a lot that the opposite also happens. Like, you'll be out and you'll be talking about it, and someone else will say, "Oh yeah, I got a CPAP machine." Like, "Oh really? You have a CPAP machine?" Like, "Oh yeah, I got a CPAP machine too." And I think that happens in the opposite. I think that it is embarrassing, but at the same time, that's why people like those clubs and forums and things, because you want to know that you're not alone, and it's a very common problem. I mean, it's not just like by your occupation. I mean, today I saw this. He's a lawyer. I mean, he's skinny. He's 53. He looks great. He doesn't smoke, doesn't drink. He's thin, and he has sleep apnea. He has significant sleep apnea. It doesn't obey the common or the classic, what people think. It's not everyone with a 20-inch neck and who's overweight. That's how they first found it. Those are the patients that they being in the medical community recognized that they had this problem. But I mean, we've come a long way since then, and it's honestly a lot of times it's just an anatomic. You just got some unfavorable anatomy in your throat, and unfortunately, that unfavorable anatomy is not letting you breathe properly all night long. So, yeah, it's all faces, all sizes, all sex, all shapes. It doesn't really discriminate. By the way, I think we should move on here to congestion. So
Okay.
let's talk about
I'm
that.
gonna let you talk to Juan and start directing him on the slides.
Yeah. Okay. There you go. So this is our woman here, the cartoon of the nasal anatomy. I just want to put this up so we know what we're looking at, and we're going to go over some real life example stuff. So this is just to get started, but the nose has a wall in the middle, the nasal septum. And if it's not in the middle, people call that a deviated septum or, septal deformity. And then you have those things on each side of the nose called turbinates. And most people don't know what those are. We're going to talk a lot about those. Those are super important. In fact, the reason, I've never met somebody who wants to be a chronic mouth breather. Have you, Steve?
No.
Yeah.
No.
Nobody wants to breathe through their mouth all the time. And it's because our mouth, it's uncomfortable. You get a dry mouth, get a dry throat. All mammals are not designed to breathe through their mouth. They're designed to breathe through their nose. And the reason we're designed to breathe through our nose, or what makes our nose special from our mouth, are these turbinates. And these are the organs of our nose. They're kind of like penises in your nose. And I hate, they are full of erectile tissue. They hold a lot of blood, and that's where all the warmth and humidity is kept in our blood. And so that's what allows your nose to be a radiator. It's these turbinates that provide tons of surface area to the nose and a ton of blood to the nose. So we're going to talk a lot about those because those can cause problems. And then around the face, you have those rooms that are called sinuses. And sinuses are not your nose. They're next to your nose. But when those aren't healthy, I'm going to show you an extreme example just to make the point later on. That will also make you feel congested. That's why patients come in and they'll say, well, I have sinus problem, or I have a allergy problem. And to them, that is what they have, but that may not be what they have, or they have that plus other things going on, right? So we do all of my exams. We do nasal endoscopy. I show all my patients inside their nose, and I'm going to show you some examples of patients' noses in a few slides here. And
are there bones in there?
Yeah, so the septum, the wall of your nose, towards the tip of your nose, it's cartilage, but as you work your way back, it turns into bone. And then the turbinate is suspended in your nasal cavity with a thin sheet of bone, and then that thin sheet of bone is wrapped in erectile tissue, and that erectile tissue is then covered up with mucosa. Yeah. So it's just the general anatomy, and I'm going to walk you through some pathologies here the common ones this is not all inclusive, but so can I drive or yeah, I can. Okay. So this cartoon here is showing you what like a deviated or deformed septum. So when the wall is not in the middle, it's bent to one side or the other, then that side was going to be smaller. So if your wall is bent to, this is, I know it's backwards, but this is left. It's opposite of what, it's not like a mirror. It's like a CAT scan. So if the wall is bent to the left, then your left nostril is going to be smaller than your right, well, I should say nasal cavity. And so you're not going to get as much air through your left nasal cavity as your right. Now, you may not perceive it if your right one's really open. Like it's kind of like if you can have good vision in one eye, but not so good vision in the other eye, you tend just to use the good eye. Like people wear contacts, they used to wear contacts, and, one would fall out or you would get messed up and you just have one contact. You kind of just focus on the good eye. So deviated septums or deformed septums are usually pretty easy to fix. They make big improvements in people's breathing. I'm going to show you a picture here of a patient I took care of. So this is the right nasal cavity. And you see that looks like a iceberg sticking out to the left side of the photo there.
Yes.
Yeah, that's the deformed septum. It's bent to the right. So just if you're just imagining you're like air and you have to go through this nose, right? You'd have to go around that thing or under it or whatever. You can't just go straight through the nose. Okay. So septoplasty is the operation that we do to make it flatter, to make it straight. And It normally is done through a 1 centimeter incision that we then work through that 1 centimeter pocket using endoscopes and instruments. And through that 1 centimeter incision, we can accomplish this. Okay.
Wow,
So
what a difference.
we went from here to here, just, okay. And that's like a 25-minute operation. And I can do it in my office under local with no anesthesia. You know, you don't need to go to the operating room. You don't need to be intubated. You don't need to get paralytics. You don't need to get propofol. You don't have to take, you know, the 5-drug cocktail to get this done. And believe it or not, it doesn't hurt much. It's not painful to recover from a septoplasty. This isn't a nose job. We're not, you know, there's no facial bruising. There's no facial swelling. You could have this operation and go to the Galleria and nobody would know you had it done, except you'd have.
Can you go back to work the same day?
Yeah, the next day. I mean, you have some bleeding, you know. I don't put splints in the nose. I don't put packing in the nose. These are terrible things that a lot of ENTs do that I haven't done for 2 decades. I've had packing. I had my nose broke when I was 14. Someone did it for me, and I had to have packing, and it is very miserable. I don't do that. So and it's not a moving part, so you know, it doesn't move. So you might take a few Advil afterwards, and that's about it. It's pretty easy to recover from septoplasty, and it's a guarantee. When you're done, it'll be flat. It won't be bent. I mean, it's pretty straightforward. Okay, so that's something I see very commonly in my practice. The next kind of cause of congestion that this cartoon is showing you is big inferior turbinates. And if you're an Afrin user, or you like Afrin or other products, like you like Vicks Vapor Rub, you like Sudafed, you like Allegra D, you like Full-Way Spray, you like Neosynephrine, if you're one of those people, then one of your problems most likely is that these things are large, okay? So have you ever had a cold, Steve, like when you're sick?
Yes. So are you saying those products are bad for you?
Well, what I'm saying is if you're using them, you're probably treating this problem. And yeah, they're bad for you because the way they work is they constrict blood vessels. And, you know, your nose is very good at absorbing things, like it absorbs cocaine very well. It absorbs flu vaccines. It absorbs migraine medications. It absorbs pretty much whatever you put in it. It absorbs very well. So when you put even a topical decongestant in your nose, that drug gets in your bloodstream. And if that drug's job is to make your blood vessels smaller, then it's going to make every blood vessel in your body smaller, which means your heart is going to have to work harder, which means your blood pressure is going to go higher, right? So yeah, if you're sick and you're otherwise, you know, healthy and you need relief from your congestion for a few days, sure, you can use a decongestant, no problem. But what ends up happening is people like the way they breathe with it, and they just start using it more and more regularly, and that's where the problem comes in. But what you're doing when you do those medications is you're chemically squeezing the blood out of these organs. And my analogy is it's like taking a grape and you're chemically making it a raisin temporarily. Okay. And so when these are smaller, you breathe a lot better, but then the medicine wears off and then they get big again. And now you can't breathe and now you're congested. And so you reach for the drug again. Does that make sense?
Yes.
So again, if that's a temporary one-off kind of problem or once a year thing, that's no problem. If you lay down at night and you're like, during the day, you're like, oh, I breathe okay during the day, but when I lay down, I feel congested. It's because these things are swelling, because when the blood in your face, when you lay down, your heart and your face are at the same level. And so the venous blood just pools to your face, and then these things just passively grow. If you lay on the right side gets big, and the left side opens up. Then you lay on the left side gets big, the right side opens up. I'm sure you've experienced alternating nasal congestion. That's this problem, okay? So just like you can chemically make it smaller, we can also mechanically make it smaller, and that's called a turbinate reduction. Again, another procedure you can do in the office in 15 or 20 minutes. It doesn't hurt afterwards. It's covered by insurance. It works 100% of the time, okay? So I'm going to show you an example of a patient I took care of. This is...
Hey, Dr. Ludwig, we just got a text from Houston They want to know, I'm really enjoying the show. Do allergies correlate to nasal congestion?
Yes, we're going to talk about that coming up. So I'll talk about allergies in just a second because it's in my presentation. So this is an example of a patient. You can see the upper left photo is this. It's actually she's a teenage girl, and I mean mouth breathe all the time, always congested, and that is her left nasal cavity, the upper left picture. And that's her doing rinsing and Flonase and treatments, and this is the best she can do with daily medicine, Zyrtec, rinsing, Flonase, the whole 9 yards. And she's always congested. The right picture is after I fixed it for her. I did surgery on her turbinate.
What a difference.
Yeah. Now, we're not trying to remove your turbinate. God put it there for a reason. I just told you, it's what allows your nose to humidify. We're not trying to remove them. We're just making them smaller so you can breathe, okay? We're not trying to destroy the function of your nose. And in fact, we're not going to destroy the function of your nose. But this procedure is not expensive. I mean, the quality of life that this person just went from before after is like, through the charts. The bottom right picture is the bottom left picture is her right nasal cavity before. And the bottom left picture is the after result, okay? So again, in addition to the surgery, she's doing medicine. If you suffer like the caller or the text person, if you suffer from severe nasal allergies, you need to treat, and I have some pictures about that. You have to treat the allergy. But if you have big anatomy, big turbinates, deviated septums, you can take all the drugs you want. You're not going to straighten your septum. You're not going to make this guy a lot smaller. And that's where we can really help patients feel better when we augment those things. And if you don't have inflammation, i.e. you don't have nasal allergy, and you just have big turbinates, and you can take all the medicine in the world, you're never going to get better, okay? So that's turbinate reduction, and this is allergy. Thanks for, it must have been planned.
We have somebody who just wrote, James, they want to know, does insurance cover this?
Yeah, yes, it did.
Okay.
Everything I'm talking about today, insurance covers, every single thing. Okay. So this is representing allergy. So allergy is inflammation. That's what it means to have nasal allergies. It means that allergens, not irritants. Irritants is like smoke. Smoke is not an allergen. You're not allergic to smoke, okay? Everyone that's in smoke, that breathes smoke in, will have airway irritation, right? I'm talking chemicals, again, irritation. That's not allergy. Allergy is, you walk by a cat and you get inflammation, or it's ragweed season and you get inflammation, or the trees are blooming and you get inflammation. That's allergy. And nasal allergy means that this space that's highlighted with what looks like inflamed tissue, that's the space that gets inflamed with allergies. Notice it's not the rooms around the face. It's just the nose. The tissues of the nose get inflamed. When you have allergies and you take a Zyrtec or a Claritin or an Allegra or a Benadryl, so in other words, if you take an antihistamine, you're doing nothing to stop this raging inflammatory reaction in your nose. All you're doing is blocking histamine that's produced from this raging inflammatory reaction. Do you understand? You're not doing anything to stop the raging inflammatory reaction when you take antihistamine. All you're doing is blocking histamine from binding to histamine receptors that create more symptoms.
Okay? So it's a quick fix.
Right. It's what you're doing is you're competitively inhibiting histamine. All right. So the problem is that the cells that create inflammation you're not blocking. That's not a steroid. That's why the best treatment is steroids like Flonase, or if you're really bad, you can do oral steroids for a short period of time. But when you take Flonase, what you're doing is suppressing the inflammatory reaction, and therefore suppressing the amount of histamine that's released in the first place, so you don't need as much antihistamine, right? And the other thing you should be doing if you suffer from allergies is you should be rinsing your nose with salt water, because it's like if you walk through poison ivy and then you had a rash on your leg from walking through poison ivy, I'm pretty sure you're going to wash off the poison ivy. I don't think you're just going to leave poison ivy all over your leg and then take Benadryl or put steroid cream on it, right? So the same thing is that there's a bunch of, you're breathing all day long. You're breathing 24 hours a day, which means you're breathing in allergens 24 hours a day. And if that allergen, if it's an allergen, if you react to it, that's what defines it as an allergen, then you want to decrease the amount of it in your nose. I mean, you can't eliminate allergens in your, I mean, eliminating exposure is very challenging. It's everywhere. But what you can do is wash it out of there once it's in there, and then put in your Flonase.
How do you do that?
It's like a mist spray. You just spray it in. And then for the saline, they make little either plastic bottle kits or they make power equipment, whichever one you prefer. But it's just you're just cleaning your nose. It's kind of like using a mouthwash in your mouth. Your mouth is, you know, the inside of your mouth is not an internal organ, and neither is your nose. So don't treat it like it is. It's not a gallbladder. It's not a liver. It's not a kidney. Okay.
Is that something you can buy over the counter?
Yeah. All those medicines are, they didn't, you know, all those medicines are now over the counter. Flonase.
Okay. So the spray to clean out your nose, you can buy over the
Salt
counter.
water's over the counter. Flonase is over the counter. Allegra's over the counter. Yeah. Okay. But you can, I mean, you may need all three if you have bad inflammation. But anyway, so this is another cause of nasal congestion. All right. And then this is an example of a patient, he's a friend of mine actually, who has bad nasal allergies. So if you look at the top left picture, you know, that's not a healthy nose. I mean, look at the two left pictures. There's blood in there. There's mucus. It's crusty. I always tell people your nose should look like your lips. Okay, if your lips look like that, Steve, you would never be kissed. I mean, nobody's gonna kiss lips like that. So, and then the right pictures are that reaction being properly managed. So that's rinsing and Flonase and maybe immunotherapy, and histamines, whatever is required to suppress the inflammation. So, I mean, if you're walking around with a left nose here, the upper left picture is the left nasal cavity, the right lower picture is the right left lower picture is the right nasal cavity, you're not going to feel good. I mean, you're not going to breathe through your mouth very well. But the other thing that's happening in the picture on the right is this patient also had turbinate reduction and septoplasty. So you can really see what the benefits of combining medicine and surgery are for making your nose work better for you. I mean, just look at the right two pictures. I mean, I think it's pretty obvious you'd rather breathe through the right sided pictures than the left sided pictures, you know? And you can see how if your nose on the left looks like that, you could have nasal drainage and postnasal drip, right? Because all that crap is running down your throat all the time. You see what I'm saying?
Yeah.
But it's interesting because this is, to me, it's like so rudimentary, basic stuff, but yet patients
don't know this.
They don't know that stuff, and they don't have a way to look in there. And then they go to their family doctor who doesn't look in there. They use their little one eye, otoscope to look in the nose. I mean, we can see through the whole nasal cavity. I can take it from the front to the back. It doesn't hurt, and you can learn a lot and understand why. Why does he want me to do? I'm not using Flonase, I'm not so way. But when you see this, you understand why you need to use it.
It's funny you said that because I think back on my my general practitioner. Gosh, when I was growing up, they'd look in your ears, they'd look down your throat, they'd look in your nose. I have never had. I bet you it's been 25 years since I had a doctor look at me in my nose.
They don't look much, I can tell you that. Yeah. And then they just go by what you say. And so you say you're congested, or you say you have you have a sinus infection. Here's antibiotics. I mean, how do they know? They don't look.
Right.
We have allergies. Take this. It's almost like, I mean, I get it. There's only a handful of things to try anyway. But, the thing is, I mean, I have a patient today, they've gotten 6 courses of antibiotics in the last, 9 or 10 months for sinusitis. Their CAT scan's normal. They don't have sinusitis. I mean, you're getting the wrong treatment, buddy. I mean, that's why you're not getting better. You got to have the right diagnosis, or you're going to not get better. It's just, and people will walk around with this.
People don't know this though.
I mean, they don't know, and they'll live with it for a very long time because they think it's, I don't know. Maybe they think it's like super. So maybe they think it's super expensive to fix it, or they think surgery is super expensive, or they're scared of surgery because it hurts, or. Look, the surgeries don't hurt that much. They really don't. I mean, it's definitely no worse than getting a tooth pulled or something like that. If people get that done, or a root canal.
Look at the difference between the two, though.
Without batting an eyelash, people will get root canals and teeth pulled. I mean, my wife's an oral surgeon, and people won't bat an eyelash. It's like, You can rip a tooth out of my jaw, but I'm scared to have my nose worked on. I mean, it really doesn't make a lot of sense. It's really just, and I don't mean this in a derogatory way, but it's ignorance. It's not knowing. I mean, I'm ignorant about a lot of things. I don't know. I just don't know. And when you don't know, you either get your information from people who don't know also, or you try your best to fill in the gaps. And unfortunately, a lot of times that's not good information. So seeing is believing. That's why I show everyone their exam. They get this. If you come see me, you get this exam. You get this on a 56-inch monitor right in front of your face. You see exactly what the pathology is, and you decide for yourself. That's the beauty of it, okay? There's one more thing we need to talk about before we finish. Is sinuses. We haven't talked about those yet. So that's the other major cause of sinusitis congestion. And this picture is showing that the nose is not inflamed. You notice the swelling is all in those rooms around the face, because sinus inflammation only affects the sinuses. And you can have a normal nose and have this going on. And if you do have this going on, you can't see it unless you do a CAT scan. There is no camera that's going to find this for you. And if you have this going on, you're going to feel congested. Okay. That's the symptom you get: drainage, congestion, facial pressure. Some of those, all of those, you will have some kind of symptom like that. This is not an infection. This is inflammation. This is like a rash on your skin, but instead of it being on your skin, it's in your sinus. And it causes the lining to get really swollen. And when the lining's swollen, it's not functional. It just like if you have a bad rash on your skin, that skin is not protecting your body like normal skin would do. Okay. So the way we diagnose this is we have to get a CAT scan. And the way we treat this, if you have it, it's actually similar. It depends on the cause, but it's usually rinsing and Flonase. But unfortunately, it's hard for medicine to get in all these little rooms because the openings are so tiny. You just can't get the medicine in there. And you could take oral steroids, but the problem with those, I'm sure you know, they're not safe. You can't use them long term. And this is a chronic problem. This isn't like you're swollen for a day or a week. People that suffer from chronic sinusitis are like this pretty much all the time. And what they do is they get better and worse, but they're never normal. And their normal is bad. So they don't even know when they're bad because they only know when they're worse, if that makes sense.
Do they cause headaches?
It can, yeah. So if you're always inflamed in your sinus, but you can't see it and no one's ever saw it, no one's ever told you, and to you that you're normal, then you don't know that you're abnormal. And then really you only complain is when you're really bad.
Right.
And then you complain and then you get some kind of treatment which maybe minimizes or slightly improves this, and then you just kind of wax and wane. So CAT scans, by the way, are $150. I mean, this isn't thousands of dollars to figure this stuff out. And they're done in the office in 45 seconds, and then you get the image right then. So I'm going to show you an extreme case just for, I guess, maybe shock appeal. But this is a patient of mine that's got polyps. Have you heard of polyps? This is literally when the tissue gets so swollen in your sinus that it starts to pedunculate like a water balloon. And I'm going to show you the after of this picture. You won't believe it. This is his left nasal cavity. Okay. Now, unless you look at that translucent looking mass with those little blood vessels is the polyp. It's not pink like the mucosa. These polyps have no sensation. You can remove them. They don't hurt. But they come from underlying chronic sinus inflammation. So you can remove them, but if you don't do the medical management, they're just going to eventually recur. But this is his left nasal cavity before treatment, and this is after. Look at that.
Wow.
Before, after. Before, after. And we did some other things for him. His turbidate's a little smaller. He has some sinus surgery up there in the distance. But I'm just trying to give you some examples of some things that we see on a not too infrequent basis. And if you have this problem, you probably can't smell very well, if at all. So problem smelling is a good sign of polyps too, okay? And if you take Flonase and rinsing and Allegra and decongestants, it's not going to help you if you got this thing sitting in your nose, okay? That's his left side. And then his right side had a I don't know if you can see up in the distance there, but there are some lumpy things in the upper part of the nose there. It's not, it hasn't grown as far down. So he can move some air on the right side. This is his right nasal cavity. And actually his nose doesn't look that bad. Like the tissue of the nose doesn't look that inflamed, yet he has polyps. So just another example of how sinus problems are not allergy problems. And then this is the after. Nope, no, it isn't. I put the wrong picture. My bad. All right, we'll skip. So in addition to polyps, you can have bad sinuses. So this is a CAT scan of a patient of mine with bad sinus inflammation. So normally, if you remember the cartoon I showed you, normally sinuses have air in them, okay? All this should be air. This guy, and on an x-ray, air is black, right? Yeah. Your ribs are white and your lungs are black, right? On a chest x-ray, your ribs are white, your lungs are black. So in your sinuses, the room is black and the bone is white. So there's a little bit of air right there on the right side. You see a little air, a little tiny air. Yeah. But the rest of his sinuses have no air. Look at that. And his septum is bent to the left. You see the curve in the septum. And he's got big turbinates. I mean, he's got the blue plate special. He's got deviated septum. He has big turbinates. I mean, the only way this guy breathes is you can see some black inside of his right nasal cavity. That's it. I mean, do you know how unhappy this guy is?
Wow.
And this did not happen overnight. He's been living like this for a long time. And
how did he sleep laying flat?
And
that even made it worse.
Right. It's terrible. And then on this coronal image on the upper right, you can see it goes from the forehead all the way back. I mean, it's like nonstop.
What made him finally decide to come in?
He's just miserable. He just decided to, this guy's not, he's not poor. I can tell you right now, this is not a money problem. He's a busy guy. I don't know. But now I'm going to show you the post. So this guy needed sinus surgery. When we do sinus surgery, and at the same time we did the surgery, I also made his septum straighter and made his turbinates smaller. But we open up all this trapped disease and we clean it out, and then you get lots of drugs, okay? To a lot of like steroids and things to help suppress all this raging inflammation. But his CAT scan now is like this. So now what you see are these, all the little rooms are open and the little ones between the eyes are gone, and you just see air. See all that air?
Wow.
Okay. So he has a little swelling left in the maxillary, these cheek signs, you see a little gray, but I mean, nothing compared to where he was, this is a home run. I mean, compared to where he was, he went from misery.
And this was a one-time procedure?
Yeah. Mm-hmm.
That's amazing.
Yeah, this is about a 2.5 hour surgery, this one. This is
how long?
This is 2.5 hours.
Okay.
Yeah, but honestly, I mean, believe it or not, it doesn't hurt that much afterwards. I know you probably don't believe me, but if you're trying to tell me he doesn't feel bad with this and he's going to feel bad with this, so I mean,
difference.
Yeah. And then, there are some patients who have surgery, and despite surgery, like this patient had surgery, and you can see all this kind of golden lumpy stuff in here. So when you see gray on the CAT scan, when you see like this gray stuff on the bottom here, in the visual spectrum, in other words, what we would see when we open that area is we would see this golden stuff like this. This is what unhealthy sinus tissue looks like. And this is what healthy tissue looks like. This is the same person. This is healthy. This is unhealthy. This is healthy. This is unhealthy. You see a difference?
Major.
Yeah. So this is what I mean. This is an open sinus cavity. The wall to the eye is on the left of the picture. But the point is that we open up all these rooms through the nose with tiny instruments. And these walls are like the thickness of eggshells. And we remove or release all that trapped tissue. And you still, when we're done with the surgery, sinus surgery does not remove your sinuses. What it does is it simplifies the anatomy of the sinuses. You still have sinus mucosa when you're done with sinus surgery. All of this space I'm showing you on this picture is lined with sinus mucosa. Okay? It just
you have to go through the opening in the nose, or do you have to make a decision?
So you, again, just like the other surgeries I told you about, there's no change to your face. There's no black and blue eyes. There's no swelling on your face. There's no cast on your face. I don't put splints in the nose. I don't even use packing for this surgery. I mean, it's, it's honestly not a terrible recovery. People are not calling me after their surgery begging for pain medicine and telling me they're miserable. They're just not. Not when you don't pack them and not when you don't use splints and things. So all of those problems can be corrected at one time, and either I can do it in the office under local. I mean, this is not a case I would do in my office. I mean, I'm sorry. This is not a case I would do in my office under local. I mean, I can't keep you numb for 2.5 hours, but a lot of patients aren't this, a lot of patients are not this bad. I mean, I give you a bad one just to make a point, but most patients, fortunately, when their sinuses are sick, they're not that sick. So we can oftentimes do lesser procedures in like balloon or whatever in the office, but give them really big benefits.
Dr. Ludwig, our president, I don't know if you've heard this or not, but I've listened to him a lot. He sniffles a lot. He'll be talking and sniffle. Is that because
it's one of these things I've shown you already. It's something in here. It's inflammation of the nose. It's inflammation of the sinus. It's not controlled. And, that will drive everyone around him nuts except for him. And I had a friend like that, well, we weren't friends when I first met him. Obviously, we weren't friends. But after I got to know him pretty well, I was like, Daniel, you're driving me nuts. Okay. I mean, nonstop driving me crazy. So he came in and I mean, he has most of these problems and we took care of him and now he doesn't do it, and his kids all have sinus problems. It is kind of genetic. Both his daughter has sinusitis, his son has sinusitis, allergies, big turbinates. So it definitely runs in the family. But the quality of life that you can get by fixing these small things and doing a little work, it's not that expensive relative to other medical. I mean, people are paying more for facelifts and nose jobs and Botox that don't improve their quality of life. I'm sorry, than making your nose healthy and not being congested all the time and getting sick all the time. I mean, it just takes one visit to do the exam and the CAT scan. In one visit, what's going on, and then you make a plan and you execute the plan and you get these outcomes. And that's the great thing.
It definitely affects your sleep.
Sure. And again, try to use a CPAP machine when you have this in your nose, right? Or try to use a CPAP machine when you've got a nose like this guy, right? So that's what I mean is if you have a bad airway, you need to have a good airway to treat, either to treat sleep apnea or just to have a better sleep quality without sleep apnea or just to have a better quality of life, I've never had a patient be unhappy that they're breathing better through their nose. It's never happened.
I wouldn't think so.
No.
That is really that's
there
amazing.
You go. Those are my slides.
Thinking back with the president, he gets checked up all the time. I wonder why they don't hear that sniffling and look into that.
Because your family doctor's not going to know what to do about it anyway, and he's too busy worrying about your blood pressure and your diabetes and your weight and when your next colonoscopy and did you get your EGD and what's your blood work. I mean, how many problems do you want this guy to be an expert at? They just don't know. And they don't send, or maybe they do refer, but you don't go. I mean, it's I have people who I show them these problems and they choose to not have treatment, but then I see them 2 or 3 years later and now they want to do what I told them to do. Let me rephrase that. What I recommended they should do 2 or 3 years or 4 years before. I mean, listen, I breathe okay through my nose. I'm fortunate that I do. I just here to help you understand why you don't breathe well through your nose or why you've suffered the way you do and what you can do about it. But really, it's all in the evidence, which is the CAT scan and the endoscopic. And then the nice thing is, just like these patients all have before and after photos, you would be surprised how many patients I see that go into other surgeons. And I'm like, well, did you know you had a hole in your septum? Well, no. Well, did you see your exam after your operation? Oh, no, he didn't show me anything after my surgery. Yeah, because you have a hole in your septum from your nasal surgery and he didn't show you, which causes all sorts of other pathology. I always show my patients the before and after. mean, good, bad, or indifferent. You're going to see the before, you're going to see the after. And I think that's important so people understand what they had done and what they need to do to keep their nose looking like these pictures, you know?
Do you show these pictures to your patients?
Of course. Yeah. I show them before, after. I mean, I like this patient here. I said, my goal is to get you from the left to the right. That's what we're trying to accomplish. They understand that. That makes sense to them. Yeah, I don't want to breathe like that. And then not only that, but I have their exam right next to these exams. So I have your exam, the patient, and the monitor on the left, and then I have whatever I'm trying to teach you on the monitor on the right. And you can see like, oh, and I mean, that does help. It helps to know that there's what the outcome could be and where you could go. Like, it does help to know that, right?
So let me signs that you have a problem. Is it breathing with your mouth open?
Mouth breathing, bad breath, dry mouth, dry throat, nasal drainage, frequent throat clearing your throat all the time, dry cough or cough. You feel congested, facial pressure, facial pain. You get sick a lot, lots of antibiotics.
Wow.
You're always needing meds, or if, you know, by meds, I mean cold medicines or whatever, you know, whether you take them all the time is not the same thing as needing them all the time. You may need them all the time, but you may choose, you know, which I understand, to not take them all the time. But those are the things you gotta look for.
Got a text in from University City. They want to know what drugs are bad for you if you have nasal problems.
Decongestants.
Decongestants?
Mm-hmm. They're bad for you long term. They're okay short term, unless you have high blood pressure. Then don't take them. And let me one more thing. If you have a big prostate, don't take antihistamines. If you have problems peeing, you're an older guy, you're dribbling, you have a hard time starting, all that kind of stuff, don't take antihistamines.
Okay.
Make it worse.
You know, it's so amazing. This is a life changer, I think.
Yeah,
Someone who's having trouble breathing,
it
but
really
it's
is.
like way down the list.
Right. It is.
Is that upsetting to you?
No, it's not upsetting to me. I think people put a lot of things down the list, like things they need to do around their house or this or that. But I think if people really knew the total, when I say cost, I mean dollars, recovery, pain, suffering, that's really involved in a lot of things that we talked about today, and what the benefit would be, I think it would be, for most people, a no-brainer decision. Honestly, it really is. Because not breathing through your nose well, it sucks. It really does. I mean, it's not fun at all. It's not a pleasant way to live your life.
Absolutely.
Yeah.
James, how do people contact your office, and do you have a website?
Yeah, we sugarlandent.com, and then we have a contact us or request an appointment, and then you just put in when you'd like us to call or text or email you, and we'll get a hold of you that way. Or if you're like old-fashioned, you want to call and talk to somebody, we answer phones here, so you can call our phone number 281-556-1102. And all of these exams are covered by your insurance, your visits. I mean, when I say covered, I don't mean pay, because it depends what your benefits are, but it's all covered stuff. We're not doing voodoo, experimental, medicine here. So this stuff works. I mean, that's why I really do enjoy nasal surgery and sinus surgery and
you can tell
treating nasal problems, because I know the outcome. I know when I'm done, you're going to get this outcome. And so I really enjoyed treating that.
Yeah, it's like sleep apnea. I mean, my life changed once I went on the BiPAP machine.
Right. Yeah. Some people just need a bigger problem or a more severe symptom before they finally do something.
Right.
I get it.
Exactly.
Yeah.
What's the phone number to the office again?
281-556-1102.
Okay, those are for our people listening on iHeart or radio who are not watching this.
Yeah, it's terrible. If you can't see, please watch the podcast later, because I think these visuals are very
absolutely.
Yeah.
And you'll be back again with us next week.
Yes, sir.
We've got James on with us twice a month because listen, this is very dear to my heart. This is important. And then we're seeing the letters that are coming in. James, we'll see you next week. How
Okay,
do you top? I didn't think you could top your last show.
yeah, we'll
You
get back
did it today.
Oh, thank you. Yeah, well, we figured out the slide problem, so we'll do some more sleep next week.
Beautiful. We'll let you know, James, what day James is on with us next week, and we'll see you soon, James. Thank you.
Thanks, Steve.
That's Dr. James Ludwig with Sugarland ENT and Sleep Center. Oh, he is amazing. I mean, listen, if you've got sinus problems, he's the man to go see. I wish I'd have known about him 15 years ago. Anyway, that's it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.